name is Evan O'Keefe. I'm a medical student from the University of Queensland Ochsner Clinical School, and on behalf of my other co-authors, today we'll be talking about the upcoming paper, Exercise Counteracts the Cardiotoxicity of Psychosocial Stress. So we'll be looking at the relationship between cardiovascular disease and mental health, and how exercise can be the common link that improves outcomes in both. So an important study came out from Onda a couple years ago that said a simple answer of yes to the question, have you felt so sad in the last month that nothing seemed worthwhile, gave its patients a 5-fold increased risk of developing heart disease. For our patients who already have heart disease, currently nearly half are reporting depressive symptoms, with a quarter already being diagnosed with major depression. And where exercise comes into the picture, for me personally, came when I read the ACLS study that said their patients with high cardiorespiratory fitness matched with low levels of negative emotions had an over 60% reduced risk for all-cause mortality. This all became more interesting when I went back and revisited my mentor's previous studies, Chip Levy, that said in one study, that nearly all the mortality came from a high-stress group who failed to improve their exercise levels. Then on the other hand, there was another group who completed a full cardiac rehab stint and were still reporting depressive symptoms, and they had nearly a fourfold increased risk of mortality as compared to their non-depressed counterparts. Jumping over to my other co-author, James O'Keefe's recent work, he found that it wasn't just exercise, but rather meaningful exercise that gave its patients the best chance at improving their lifespan. Being mostly in the form of team exercise, with badminton, tennis, and soccer topping the list. The burden rather falls on us as physicians to encourage our patients to find those meaningful forms of exercise, whether it be taking a walk with a loved one or picking up badminton for the first time, that will help improve those outcomes in both CVD and mental health. We chose the Mayo Clinic Proceedings to publish this article in particular because my two co-authors and mentors credit Mayo with not only teaching them such an all-encompassing view of cardiology, but also the nuances of behavioral cardiology. And so we thought this was a fitting place. So from us, we hope you enjoy the article, and it's been a pleasure.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.